and welcome everyone to this month's call of Open's Action for Medicare Dental Learning Collaborative. This is Stacy Chazen with Open Inc. Want to let you know today's call is being recorded. We have a small group right now, but perhaps just keep yourselves on mute to avoid any background noise as people are joining us now, and feel free to use the chat. I'm going to turn it over now to Melissa Burrows with Families USA.
Thanks, Stacy. Hey, folks. Thanks for joining us today, especially realizing that there are many exciting meetings and events going on, and also lots of not exciting, terrible things going on that may be needing and taking your attention. So I really appreciate having the time with you all today. And our agenda for this Action for Medicare Dental Learning Collaborative meeting is both to do some looking forward and to do some looking back. So I'm excited to have that conversation with you all, and kind of see what we can take away from what we've learned thus far in our journey, both on Medicare Dental and as we can apply some learnings from other things that we've all been working on. So the two actual agenda items that we have for today is I'm going to provide some updates on the medically necessary Medicare Dental effort that we have been working on with the administration for many years. And I know all of you in this call are probably familiar with that, but I'll give an update on where we are. And then second, I did want to take a moment for us to reflect on the Medicare Dental legislative effort that was moving through Congress last year. What went well, what didn't go well, and particularly what we can learn from similar experiences you all have had in oral health advocacy in other contexts that might be instructive for where we take the conversation from here as we rebuild on that sort of congressional facing front. Is there anything else folks want to make sure we talk about today or that would be helpful in your own work? All right, and I know we have a small group today, so feel free to chime in at any point, and we may have a short call today, and that is all good. So first, on the medically necessary Medicare Dental issue, for any of you that haven't been tracking that, that is an effort that has been going on for quite some time now, really for decades and much even more intensively for the past 7 years or so. And the effort is to have the administration through the Center for Medicare and Medicaid Services make a change in its coverage determinations for Medicare that would allow for some coverage of dental services when they are directly connected to medical services. This is something that does not require legislation. It's something that CMS could, in theory, do today. There's a lot to still be worked through in terms of what that means in practice, what exactly would be covered, how exactly it would be implemented, all of that kind of stuff. But the good news is that CMS is asking to have those conversations. Center for Medicare Advocacy, and Weiwei is on today, has really been leading the charge on this issue for ages, and is working with CMS on a set of listening sessions that really is a great indication of how far we've come in terms of their interest. Weiwei, I don't know, is there anything that would be helpful to talk about in terms of the listening sessions with this group or input that would be useful to you?
Well, I just want to, okay, the next listening session is happening on June 24th. So that's coming up pretty soon. And CMS really wanted us to address operationalization issues. So our first session dealt with clinical indicators. And I think, what we presented to them really wasn't lost on them. I think with Dr. Chalmers there, they're really, getting a lot of education on the impact that dental can have on other medical conditions and treatments and management of conditions. So, they really wanted us to address some of the sticky issues about how to operationalize an expansion of coverage, whether that, we don't know, what the scope of such an expansion they're even thinking about, if it, whether it's small or broader, but, so they want to talk to folks, presenters that we put on who could maybe speak to some of those issues. So, and I think I've mentioned this, some of you already know this. So we have been, talking to folks and thinking about this idea, like how would Medicare do this? Because it would be breaking new ground for them, and there are lots of issues about like delivery, would there even be enough dentists to enroll, who would enroll to, provide this kind of care. So, we're thinking about possibilities. One possibility would be to create a new set of contractors, just like in Medicare, how durable medical equipment, they have a separate type of contractor that, knows the types of providers and can kind of, coordinate all that, as the enrollment, as well as, the processing the claims. So, the idea would be just that, contract with company organizations that already do this, operate in this area, instead of putting it on a contractor that knows nothing about dental. So, we're just talking these ideas out right now, and putting them forth. We will be putting them forth to CMS as it kind of continues to think about it. Again, we don't know where they are on this, if they're really anywhere, but at least we're, moving the conversation forward more.
Yeah. And don't undersell that is actually a really important thing. That interest really does mean something, even if it, we don't know what it'll result in, but it shows they're paying attention in a way they weren't before. Wait, I see that Deb had a question in the chat. Would there be enough providers, if not restricted to dentists? Thinking about dentists, dental hygienists, dental therapists, and more.
Right. And so I think, that's definitely a part of the conversation, because that would help a great deal. No doubt. Yeah, that would make a big difference.
Yeah, and Chelsea knows, I'm sure, how I feel about this. It's not that I don't think the doctor of dental surgery is necessary. I think they're absolutely necessary, but I think that if we're going more towards primary care and reaching everyone to triage them into care, then who better than Medicare to start saying, oh yeah, we can't get everybody into an operatory, so let's get the right people into them or get the right care out to them. Opinionatedly yours.
And I feel like there has been more of a movement, in the past decade or so, to recognize, nurse practitioners, physicians assistants, and this is sort of along that same trajectory. So.
Any other questions on that topic? All right, and the one other thing I'll mention on the medically necessary front, which I've been saying to you all for many months, so you may have heard me say this before, but we are working with Senators Cardin and Stabenow, as well as Representative Berrigan, on a Dear Colleague letter that will be a letter from Congress to the administration urging them to look at this issue more closely and take action on it. Really asking them to carry the torch where Congress fell short. And that letter has been kind of in process for several months now, but we do keep hearing from those members of Congress that this is a priority for them and that they, want to they do want to do such a letter. So if you have contact with those offices for any other reasons or for this reason, feel free to remind them that we'd love to see their support more publicly on this medically necessary Medicare dental issue, and that we really appreciate everything they've done for oral health, and that this would be a great next step. And B, when we do have that letter, which I do believe will happen within the next month or so, it'll be a really important time to reach out to your own members of Congress and ask them to join in support. So there will be a couple of action items coming up on medically necessary Medicare dental. This is still a really important political window to try to move this issue forward. It's something the Biden administration could really tout as a health win, as a win on something that They tried to do and Build Back Better, and now they can just do without having to deal with all the mess in Congress. So between now and election season is a real time they're looking for wins like that. And this is something that we've been fighting for a long time, so it's the right thing to do for people. And so hopefully we can take advantage of some of the momentum that's there. But obviously there's a lot on politicians' plates at this moment, as there is on all of our plates. So that is, I think, everything on the medically necessary effort, unless I've missed something or folks have questions. Great. And so the second conversation I wanted to have with you all is the other piece of what we're doing on Medicare Dental this year is really learning from what we have built so far and what we experienced last year, and then building to move forward to make this effort as strong as possible, and to be best positioned to take advantage of the next political window in Congress, whether that comes in the next Congress, whether that comes in the next presidential administration, whether that comes 15 years from now. We don't know. It could be soon, it could be a ways, but we want to be really in the right spot. And so I did want to take a moment with you all now that we have some distance between November of 2021, when things really kind of fell apart on this, and where we are now, to sit back and reflect on sort of how things went and what similarities or differences that has to other oral health efforts you all have been involved in, and what that might mean for our future action. And so a couple of things I want to highlight as both good and challenging that I think would be useful to weigh in on are, I think some of the good things we saw is there's unprecedented amount of media coverage on this issue and on oral health issues in general. Everyone from the New York Times to the political reporters to the Philadelphia Inquirer, a lot of different places were really gaining interest in this issue. I think politically, there were a lot more members of Congress that were talking about this issue openly. There were both positives and negatives to it getting really tied into the Medicare for All movement and the Progressive Caucus. And Bernie Sanders really being extremely outspoken about it. I think that really got this issue a lot of, large scale attention, but it also meant that it was very much tied to the progressive agenda in a way that made it harder to compromise on. I think from a stakeholder perspective, we saw a lot of divisions within the provider, the community in oral health. I think there were a lot of differences of opinions in terms of the organized dentistry lobbies that some were supportive of Medicare Dental as it was in the policy. Some had their own alternative plans. Some were actively oppositional. And so those are some of the things that stand out to me as places where we need to learn from the experience. Before I kind of raise some questions specifically, are there other things that folks have on their minds as points of accomplishment or points of improvement that we could reflect on?
Melissa, you cut out for a little bit for me, but I'm not sure if you said this, but just getting I think the support from different university dental schools was really big, and education in dental. I think that was kind of key in pushing back against some of the, what happened with the ADA and having their support. So I would note that. And yeah, just generally, it felt like huge momentum. So now it feels like a big gap, and I want to restart it again.
Yeah, absolutely. Other things from other folks?
So I thought it was incredible and really so valuable to be a part of a network while that was all going on, and having those meetings, just pulling together and, having those strategy sessions. I will say though, because that whole experience was incredibly new to me, and it felt like it was just suddenly upon us, and then it kept shifting too. And we constantly had to respond to new things that we sort of didn't quite anticipate, like when folks were suddenly like talking about, oh, let's do a voucher, like, or people, Hill staff asking us, well, what's something smaller, that you could ask for instead of a big, so I feel like had we known, because we didn't anticipate that, like we were kind of scrambling sometimes to like figure out what's the right thing, where should we stand on this, what should we be saying. So I guess if this were to happen again, if we're lucky enough, to get that going again, it would be great to, be prepared ahead of time.
Yeah, I think that's a great point. There's some things you can't plan for, but playing out some of the iterations of the policy that might come up is something that we certainly could have done in more depth as a movement. And I think something that we could start doing now, again, just to kind of revisit, what are the likely things to come up based on what we've seen so far and what we've heard in other issues. And I definitely agree with you. The power of the network really was clear in a moment where we're mobilizing quickly. Other reflections generally? Great. Well, the questions I had in mind actually do really kind of feed off of some of this really nicely. One thing I would love to get feedback from you all who've been running efforts on and been part of efforts on other issues is when there are divisions among stakeholder groups, sort of how do you proceed? Like what's been effective in bringing additional voices to the table that may have previously been oppositional? What's been effective in shifting your messaging to make sure that your issue moves forward regardless of divisions? Are there things that we can learn from efforts in other areas that you've worked on that would be applicable to how we build coalitions and or messaging to address some of the divisions that did come up in the Medicare dental effort last year?
This is Deb, and I'm kind of reluctant, but I'm going to trust my colleagues to just give me some not subtle hand gesture if this is not helpful. So I think I've talked about it in some open groups that the previous session, the 2021 session in Minnesota, we had a group of people getting together that had begun to get together, and it was primarily safety net folks, but we did bring the Minnesota Dental Association in, and with support from expertise, I should say, from 3M, their global government relations person took us through what they call their playbook. And part of the playbook is, identifying what you guys probably just do in your sleep, identifying who is supportive, who's neutral, and who's opposed, but in a very conscientious way, and then craft messages for the opponents with the goal of neutralizing or putting them in, not neutralizing them, putting them in the neutral column or moving neutral people to supportive. And then the thing that I think for us that was the most impactful was they have a recipe for a white paper. And so we did our white paper on oral health, and it was the discipline of having to go through and put everything in tight public value focused language. So that's their big thing is, not what the dental providers care about, but what do the elected officials or state agency people or whoever care about. So rewording things. And I mean, it really is formulaic, but we went through that process. And, tight little thing, has to have pictures, has to have this, list of supporters, blah, blah, blah. And then at the end of it, the last part is your asks. And they instructed us that you have one ask that's, impossible to say goodbye, say no to, like, we'd like to ask your expertise or ask you about this or whatever, who's not going to say yes to that. And then you have however many asks, and you end with the big stretch one that you really, it might take a few years to get to or whatever. And I'll be damned, we got all of our asks in 2021. Now this year it's been a little bit of a hiccup because we needed some more funding for the dental home demonstration projects, but they will still proceed, and we'll just have to get it was more political in nature why the session ended without a HHS bill, omnibus bill, and all that kind of thing being signed. But at any rate, I cannot speak highly enough about the bringing people together and the focus and the discipline of doing that process that you know, I mean, it was successful. So anyway, I don't know how if coalitions and groups undertaking a process like that is helpful or not, but it was for us.
Yeah, no, that's really helpful. And I think it is, you know, I think really important to come back to the value in the process, not just, you know, doing things by instinct, which I think we often rely on when it's moving really fast. And so that is really helpful. And is there anything you would add specifically on that concept of moving opponents to neutral or neutral to supporters in terms of the experience you had in working through that? Because that is something that I think is really important.
Yeah, and one of the things and we did a little bit of it ourselves, and then we had a student intern or somebody work on it with us, and we identified, you know, who were the chairs of the HHS committees, majority and minority, blah blah blah, and then looked at a lot of stuff online from them, from a variety of sources, to kind of get a sense of what are their values and motivating issues. You know, you might discover that somebody volunteered at such and such, or their previous gig before they were elected was, you know, whatever, and that indicates something. So it was a focus and you know, I mean, I suppose market researchers do this all the time, right? But, you know, just figuring out what's going to resonate. Because, yeah, I mean, I don't think there's anybody that wants a lot of people to suffer unnecessarily from a preventable disease. That's just not the case, but there's so much else going on. So linking it somehow into something else from their background. Yeah.
Yeah, great. Other experiences that folks in this group have that might be useful as we kind of re-energize and learn from where we fell short last year? All right, well, this will be an open and ongoing conversation. Something I personally am hoping to do more often is this time for reflection on what has worked well and where we can improve, generally in my work and also just as a practice. So I appreciate you all joining me in that. And I do think it is really helpful as we have, you know, not an immediate window to make sure that we're doing that, and then also applying our energy into this immediate issue of the medically necessary Medicare dental issue. So since we have a small group today, I think that's all we really have for our discussion, but I will open the floor just one more time to hear. Oh, I think someone may be trying to chime in.
I was. So I just want to say that if you have not already registered for the open mid-year convening, please go ahead and do so. You need to register by June 10th in order to get a hotel room. And if the sooner you can do it, the better. So we know if we have additional spaces to offer to other folks. And the agenda is pretty exciting. I'm not able to share it quite yet, but we're getting there. And the next call of this group will be July 27th. So hope you can join us then. That's it.
All right. Any other last words before we close out? All right. Well, thanks, folks. We'll talk again soon.